Hi, I'm Val Fiat with Perfect Personal Training. I'm also a subject matter expert for the American Council on Exercise. So our personal trainers and I, what we're dealing with very often are clients who have had a real bad history of back pain. And a lot of times that back pain is coming from the sacroiliac joint, or the SI joint, as it's usually called. Now, a lot of times they're coming out of physical therapy, or they've tried some generic exercises in the past. Usually the pain is somewhat better, but it's still going on. And usually it will continue to go on until we get into that SI joint and we really make it stable. Now, here's what happens when the SI joint becomes unstable, okay? There are so many connective tissue and so many muscles all going into that, attaching to that SI joint, and they all have a job to do. And as soon as one of them gets a little bit too loose or a little bit too tight or doesn't really have the kind of tension that it needs, once that whole rhythm is disrupted, we've got problems and the SI joint becomes unstable. Now, once it becomes unstable, it's usually just a matter of time before it causes pain. So first, I'm going to go through three pretty generic exercises. If you've had SI joint pain in the past, you've probably already done these three. So let's recap three generic exercises. Then I'm going to show you a couple of new exercises that you probably haven't done before, and these will be using the pelvic clock. So first, let's start with something really basic. Now, this is where you're lying on your back, and you're going to start by pulling your knee up toward your chest, okay? Then you're going to cup your hands around the knee, and then you're going to push. Now, this is an isometric exercise, meaning there's not going to be any movement, but you're going to be pushing your knee away from you and into your hands. Your hands are going to be blocking your knee from going anywhere. All right, it's just going to push, and you're going to exhale there. And you're going to hold for several seconds and then just repeat. So now let's move on to another exercise. Now, in this exercise, this is where we're putting a belt around the legs, essentially around the sides of the legs, to the sides of the knee. And where you've got that belt there so that once again, we can't really move. This is another isometric exercise where we're not going to actually have any movement. But what we're going to do is be lying back, and we're just going to pull those legs apart, or at least we're going to try to. The belt is going to keep that from happening, but we're just creating this outward motion where both legs are trying to go against the belt and trying to pull out away from the body to the sides. Okay, and now we're going to do just the opposite of that with this third isometric exercise. Here we've got this little stability ball, or an exercise ball, right between the knees, and now what we're going to do is just try to squeeze that ball. So the knees are going to be pulling in together. They're pushing in, trying to touch each other, but the stability ball is in the way, and therefore the knees, of course, can't touch, and we can't really have any actual movement. Okay, so now that we've got some of the more basic exercises out of the way, let's get a little bit more advanced and start getting into some deep pelvic tilt exercises. Here I've got a couple of exercises to show you using the pelvic clock. I can't say enough good things about the pelvic clock. At Perfect Personal Training, we use this device for exercise not only with our back pain clients and clients who are having SI joint dysfunction, but we actually use it as a preventive for everybody, or for pretty much all of our clients who really need to improve core strength. It's just a really great tool, and it helps the body, helps the pelvis especially, move in ways that are very natural and that we should be moving, but that we generally don't. Even in some pretty advanced exercises, we generally don't use the pelvis quite to this degree. This device also really helps differentiate movement through the spine and the sacrum and the pelvis, so it's really just a great device, and we love using it. Anyway, let's go ahead and get started. What you're going to do is have the round side down. This is actually going to touch the floor, and you're going to have your back to the floor, facing up, and you're going to place this flat part here right underneath the sacrum, okay? So it all starts with a very deep inhale before we do anything, and here we're going to do what we call a 6-12, referring to a 6 o'clock, 12 o'clock exercise. What we're going to do is inhale first, and then exhale big as you perform a deep and very targeted crunch that involves tilting the pelvis forward, or in this case, because of your position on the floor, you're tilting the pelvis toward the feet. And that's going to be, as you can see here on the clock, that's like the 6 o'clock position, okay? So you're exhaling as you perform the movement. You're going to do a great big exhale, and then you're going to hold that position for a few seconds, and then draw another big inhale, and then exhale big as you now tilt the pelvis up toward your head. Okay, so now you're actually tilting the pelvis back. Again, you're going to exhale while you perform that very deep and targeted crunch. And then you're going to hold that for a few seconds and then repeat. So here you're just tilting from 6 to 12, okay? This is a really good, important exercise. Get good at it, practice, and enjoy it. Now let's move on to a very similar exercise. It's going to be just a little bit different, okay? Now here, instead of starting at 6 and then going to the 12 o'clock position and tilting the pelvis up towards your head, instead we're going to go a little bit off to one side or the other, okay? So if you've got pain on your right, you're going to tilt a little bit to your right as you come up. And if you've got pain on your left, you're going to tilt a little bit to your left as you come up, okay? Essentially what you're doing is you're tilting toward that SI joint where you're having pain. And if you look at it from a clock's perspective, that's going to either be 11 o'clock or 1 o'clock, okay? So same breathing strategy is on this exercise as it was on the last. You're going to start with drawing a very big inhale, lots of air, and then as you're performing the pelvic tilt, you're going to exhale, very, very, very large exhale, then hold that position, hold that deep, intense, powerful crunch for several seconds before you then repeat, and then inhale and repeat the process onto the next crunch. Remember, here you're going from tilting the pelvis toward the feet to tilting it up and to the left or up and to the right. If you don't have more pain on one side than the other, then you might just want to alternate. You might just want to do a set of going from 6 to 11 and then a set from 6 to 1. Okay, so I hope that these two exercises here have been helpful. Again, they're a little bit more advanced than the exercises that we began with at the start of the video. My name again is Val Fiat with Perfect Personal Training. I do hope that this has been helpful. And if you want to learn more about the pelvic clock, go ahead and visit their website, pelvicclock.com. Again, it's pelvicclock.com. You can order one there, or you can learn more about this great device and see some other exercises as well. Thanks so much, be well, and stay focused.